Well, hello, everyone. Today, I get to talk again to my friend and coworker, Alycia Wood. Alycia and I just did a podcast not too long ago, but we felt we needed to do another one to talk about some important reports and leaked files that have come out since this spring. The WPATH files, which is kind of a data dump, exposing the practices amongst those giving transgendered care, and the CAS report, which was commissioned by the NHS in England to better understand how to care for minors that are suffering from gender dysphoria. Well, what these leaked files show and what the CAS report presents is shocking. It exposes a level of malpractice that is horrifying, and what is being done to children in the name of an ideology should make all people angry, regardless of even if you are pro-trans or whatnot. Something has to be done. And we talk about that today. We bring it out into the light, try to get an understanding of what is going on in the medical community. Is it really that bad? And how do we love those that are going through or suffering from gender dysphoria, some kind of distress? How do we think about this biblically? How do we love our neighbors relationally, and what does it mean for us politically? A lot that could get me and Alycia in trouble. Hopefully we avoided the landmines and provided some clarity on this topic. Well, hello, my friend. We've been trying to do this episode for months now, haven't we?
For months. Yeah. It's been a scheduling challenge, but we're here.
It's a nice way of saying that you've canceled on me and bailed on me.
Oh, correction. That's the mic translation. Alycia did cancel the first time. However, the last 8 happened to be Mike Sherrard.
Hey, that's true. I don't know if 8's literally true, but yeah, I've been the problem for the rest. Well, and I say we've been wanting to do this for some time. It's not that we want to talk about this. It's we feel compelled to talk about this. And in late spring, there were some files that were leaked, the WPATH files that were leaked. The CAS report was published, and it's drawing a lot of attention to what many, and I would include myself, are calling barbaric medical practices when it relates to caring for those children that are suffering from gender dysphoria. Yeah. So I want us to get into that. And I think it's important to shine a lot of light on what these files show and what the CAS report found. But before we get into that, you speak on this a good bit. One of our speakers here at Apologetics Inc., one of the most requested topics I think that you get and get asked to speak on is transgenderism. What's your experience been like speaking on this, and why do you do it in the first place?
Yeah. Why is a good question, right? I mean, as an apologist, you never think that this is something that you're going to be speaking on. Whenever you go to school to study any of these kind of things, theology and Bible credibility and big philosophical questions, you're not really dealing with transgenderism. But what happens is, as the culture goes, kind of so do I, meaning, as I see the people around me that are confused or just don't know what to do or concerned, and they don't know, they just don't know how to respond to some of these things. You've got parents who say, I don't know what to do with my child who is coming out as trans, or you've got other young people saying, my friends are trans, maybe I'm trans, and you see all the confusion. And I think part of what I see my role is, or my job is as a Christian apologist, is to help bring some clarity through all of the confusion, right? Some light in the darkness. And so often I'm able to do that with, through obviously the various teachings and truths that we find in the Bible. But I think with this one, it was so, I think, not, you don't get caught off guard, but you just didn't see this one coming to the degree that it did, probably because it was a questioning of something that was so fundamentally clear. I think people thought, like, are you male or female? It was something that really wasn't a question. It wasn't really an ambiguous or kind of muddy kind of topic. It was something that seemed so clear. And then to have this rise in confusion over something that seemed so clear just became like such an eye opener, I think, for me and many other people, as to the influence of culture, social media, mental health, variety of different factors, and how much that can really impact somebody's life in a negative way, really. And so I think for me, it's been a combination of, just looking for yet how I can still help connect this Bible story, which for many people seems, so outdated or maybe so old. But yet when I see what's going on now, I think I see the relevance of it still today and the significance to bring clarity, which I'm sure we'll get to at some point here. And so I think for me, that's really where it comes from. And then I think as I began to dig deeper into it all, I began to read stories of people like Chloe Cole, who started transitioning in her early teens, double mastectomy, I think by 15, and detransitioned by 17, and all of the regrets. And I started getting on YouTube and looking at videos of people who just were crying because they were 24 and they're sterile, and they didn't realize what they were doing when they were 12 and 13 making these decisions. And just when you see their tears and you hear their story, it just breaks your heart like this. And so I think for me, it really became very personal, because I don't know how you can watch somebody's regret like that and not feel a massive sense of empathy for them. So I recently ran across a story just actually yesterday or a couple of days ago about a young girl. I know her by Griffin. I don't know. I'm assuming that's her male name, female to male. She was a transitioner, female to male, and started transitioning somewhere around 15, and shares a lot of her story on TikTok, which I don't have access to, but people shared it on Twitter, and her story was really gripping. And I guess maybe if I share this will kind of help people understand why I spent so much of my time trying to gather more about this particular topic. And it's interesting to me with this story because it's almost very routine. It's very, we could have, like, as I read her story, I'm like, this is pretty much what we see with a lot of cases. She started out having suicide attempts before ever taking testosterone to become a boy, and before ever having surgery. She was already suicidal. So she's suicidal. She most likely had depression and anxiety as well. But then she went on to get a double mastectomy and went on to get a hysterectomy, so completely sterilized now. And she talks about even how, when I was reading through her story, how even with the double mastectomy, how she still didn't like her body. She still struggled to go shirtless even after the double mastectomy. So she would wear shirts that were 2 times too big to cover up. I mean, even there's no chest there, she still didn't want even anything tight on her. And she said she only went shirtless in public one time in 5 years as a boy, one time in 5 years, because she was so... She said that her body dysmorphia just didn't really change. She still had this distorted image of her body even post surgery. But then she goes on to get genitalia surgery. And here's where things start to go really, really bad. It's supposed to be a surgery. You get a couple surgeries and you're done. Well, she had 10 or so surgeries from what I've been able to gather. And at this point, we're looking at probably somewhere around 2021, 2020, when these surgeries started. And they use skin from her forearm, which is pretty common, is they take skin from your forearm to create male genitalia. She also had skin taken from her thighs, 2 patches from her thighs. So she had these big red marks on her thighs. Her wrist was really skinny where the skin had been taken away. And they even used skin from the inside of her mouth to create this male genitalia. Afterwards surgery, she had to have a catheter to urinate, and you have to walk on a cane post-surgery and these kind of things. End up developing deep vein thrombosis, which is based in her leg, which caused damage to her right kneecap, and she nearly lost her leg. She was still depressed post-surgery, still suicidal post-surgery, right? So once again, this is still actually kind of what we already know is happens, that the surgery doesn't really fix things. Constant pain, constant infections, and then things start to continue to really go down. So let me list you to go downhill. Let me read you some of the things that Griffin has gone through: respiratory failure, renal failure, kidney infections, bladder infections, staph infections, fungal infections, lung issues, blood infection, and in 2023, a heart attack. Heart attack at 22, 23 years old, somewhere around there, 24 years old. But Griffin is still not happy with the body that Griffin now has, because even though it's post-surgery, because she complains about her shape and her weight and her curves and her dog-eared chest shape and the stretch marks and the acne. So I want to read you what Griffin actually said. And this is a quote, except for one word I'm changing, I'm editing. But Griffin says, "I'm trying to convince myself to think, forget what your mind or everyone around you thinks. Your body is fine the way that it is. Let's consider this step one." And you see this beginning to try to fight to accept who I am. Now, keep in mind, who Griffin is today is very different than who Griffin was before because of all the surgeries and everything. And even though the mental health is a mess still. But let me fast forward now to 2023. And in 2023, Griffin spends over 2.5 months in the hospital, dozens of infections, lupus, his 5 blood transfusions, 4 more surgeries, kidney failures. Oh, and of course, another catheter, because repeated surgeries to try and create male genitalia is not working and is causing complication after complication after complication. So not only is Griffin in pain, having trouble walking, all of these things, this is still not giving Griffin the body that Griffin was thought that Griffin would have. So July 2023, now Griffin's on dialysis. Kidneys have failed. And for those of you who don't know what dialysis is, you go several times a week to be able to essentially have a machine clean your blood because your kidneys are no longer able to help with the filtering. Suffers from internal bleeding. Hair on Griffin's head has now stopped growing and is falling out in clumps. And organs are failing, undiagnosed autoimmune disorder. And then in May of 2024, Griffin puts out this TikTok message. "Prayer/God aren't my thing, but good thoughts or tasteful memes would be appreciated." A few weeks ago, Griffin died. We don't know exactly the causes, but died in the hospital as a result of all of these things. The kidneys stopped producing urine altogether. And at 24 years old now, Griffin not only never got the body that she wanted, she never even got a life that she wanted. And I think when you see these stories, Griffin is not unusual to have these conditions, mental health conditions before surgery or before even transitioning, and after is normal. And I think as I read these stories over and over again, I think you just sit here and you say, how could I not help in some way or say something in some way?
And it seems that many, are awakening to this horrifying reality. Maybe it was a year or so ago that I heard Chloe Cole speak in person, and she told the same story that you're telling here. And part of her story is of the deep regret that she now has and the body that is forever scarred and the children she will not be able to have. And if you watch her before Congress, she has this desperate plea for help, for somebody to open their eyes and put an end to these practices that children are available to them, because many people in the West are driven blindly by an ideology and are afraid to speak up. But people are starting to speak up. And that goes to, what I'd mentioned earlier with the WPATH files and the CAST report. So my hope here is that people are awakening to what's really going on, and they're being able to see past sound bites. It's easy one hand to live in the ideological world of just follow your heart, be true to yourself. You can be, there's limitless genders, be whatever you want. I mean, it's fine to live in that soundbite world, but when you pull back the curtain and you see what is happening to these children in the medical and psychological fields, it's really horrifying. And that's, we'll get into some of these with the WPATH files, and WPATH stands for the World Professional Association of Transgender Health. And for many years, they presented themselves on the authority for medical practices, guidelines, think tank. Here's how you perform here's how you engage in gender care for those that are suffering from gender dysphoria. But back in March, there were a number of files that were leaked, internal discussions, graphic images. And what became very clear was the world's leading expert in medical practice and guidelines for transgender care is they didn't know what the heck they were doing. It was experimentation. There was no guiding, not much less of a guiding ethic, but no even guiding principles, that it was politically and ideologically driven.
Yeah.
And when you read these files, and it's not an analysis, it's just a data dump of internal conversations and practices. It's obvious to anybody looking at this that what's being done is experimentation on children in the name of an ideology.
Exactly. Exactly.
So I don't know if what you came across when you looked at them, or what you've seen or heard people talking about when it comes to the WPATH files. And I do want to talk about the CAST report, because that's not a data dump. That is just an analysis. But what was your reaction when you saw the WPATH files?
Yeah. One quick thing. As far as we know, Chloe did have a double mastectomy, so she can't nurse her children, but we're hoping she can still have children. But that's kind of the uncertain thing right now, because once again, we don't know the long-term effects of puberty blockers and testosterone. So the jury's kind of still out on that. But yeah, my reaction when I read the WPATH files, I think, was probably slightly different than some other people, just because I had been in this world for so long by that point. And I remember, kind of saying, well, what's this latest thing? And looking at that and just seeing how everybody was so upset and all the podcasts that were being said. And as I began to read WPATH files, I was like, we've known this stuff though. Like, this is stuff that people have been saying. Abigail Schreier's been saying this stuff. I've been talking about this stuff. Jordan Peterson's been talking about this stuff. Like, the people who have been speaking on this particular issue have been saying these things for several years, that this is not founded on any science. It's not founded on solid data. But really what it is it's exactly what you said. It's ideology. And I believe she's still the current president, Marcy Bowers, who is a trans woman. So Marcy was Mark Bowers and transitioned to being a man, was a OBGYN doctor, married to a woman with 3 kids, and then transitioned, I think somewhere around 2007, somewhere like that, to being a woman. And Marcy Bowers went from OBGYN to being one who performs these kind of surgeries. So if any of you heard of Jazz Jennings on TLC's I'm Just Jazz, that's Marcy Bowers is Jazz's doctor, did the surgeries on Jazz Jennings. So Marcy Bowers is very well known in the trans community. And at least last I checked, was serving as the head of WPATH, right? So what you're seeing is exactly what you just mentioned. I mean, what WPATH exposed, I guess, in their own words, I think probably part of the struggle was that it's one thing if Alycia says something about it, but I'm not in WPATH. It's another thing when you actually see what they are saying themselves. And I think that's what really woke people up to realizing the doctors are admitting that they don't have good, solid evidence. One of the big things, or good, solid evidence that somebody's better post-puberty blockers and hormones than they were before. But the other thing I think that really shook people too was this idea of informed consent. And there was this whole dialogue, right, about informed consent. So maybe we could turn on that, because this idea that, that these young people, the first one, let me explain what informed consent to you is, because sometimes people just think, well, you have gotten some, really big, in-depth kind of thing. Really what you are is when the provider gives you the risks and the benefits and the alternatives of a given procedure or intervention, right? So you need to give up-to-date info regarding the nature of the condition. You need to give the proposed treatment with alternatives. And then you make sure the patient actually understood what you said. And that they were able to make informed medical decision based on what you said. And then you get signatures confirming that they got informed consent. But the reality is, and this is what you hear with the detransitioners over and over again, is they're like, I didn't know what I was doing at 12. Mm-hmm. And that's what the doctors you see
so not only did they not right. So not only did they not know, and you think of the common sense about, why there are certain laws that don't allow minors to do any number of things. And yet we think minors have the cognitive ability to make a decision like this, but not even from an informed consent, not even taking the child into consideration. The practitioners don't know the risks and rewards because there's no evidence for this yet.
Right.
So there's literally no way to have informed consent here because the practitioners don't know fully the risks.
Yes.
They don't know even the rewards. And this is some of the stuff the Cass report shows. And you're dealing with a minor who can't really make sense of it all anyways. It is malpractice at its worst, what's taking place here.
No, you're absolutely right. And I think that's what was so shocking for people is to hear the actual doctor say, I really don't think this kid really understood really what I was kind of getting at because they're so young and, you know, have they even taken biology class yet and these kind of things. And you're like, that's exactly what we're saying, why you shouldn't be doing this to children. They don't know. And yeah, and so that's exactly what's happening. And to hear it from their mouths, I think was pretty shocking for a lot of people because I think at the end of the day, people still had some hope and trust that WPATH was working with integrity. And the doctors that were using WPATH's research, were either, you know, saying, well, we're going to trust the WPATH scholars or, you know, people that know this best, or feeling pressured because there's a lot of that came out in the Cass report as the pressure or the Cass review that the pressure that doctors in the UK felt when they felt like there were some issues in the silence that they were kind of like, or maybe even being let go or pressured to leave, whatever. Right. So doctors were under a lot of pressure. And so it's like, there was no checks and balances here to really say, okay, where's the long-term study? Well, there isn't one because we've never given puberty blockers and testosterone and estrogen to children and this level before to be able to really know what's going to happen physically long term. We know from one of the Dutch studies that the effects don't necessarily cause drastic improvement long term in terms of their mental health, but we haven't even considered what the physical implications are. So yeah, I think this is what was really shocking for people.
And that's what is behind the Cass report. Whereas WPATH is just these leaked files data dump showing internally what's been going on in WPATH, the world leading, health organization giving guidance on this issue. But then many countries now starting to awaken to this, England being one of them. The Cass review was commissioned by NHS England, National Health Services, to make recommendations on how to improve gender identity services and ensure that children and young people who are questioning their identity have a standard of care that's in line and appropriate with other standards of care in other medical contexts. And this is one, I want to go through some of the key findings here because this is really important. This was a 3-year extensive review. This isn't religiously driven. This isn't partisan driven kind of thing. You think you're Republican, Democrat kind of thing or whatever. Right. This is just what do we know so that we can give the best medical care to children. That's why this report I think is pretty important. And one of the things that they found is that exploration of identity, and this isn't new to them. A lot of this is what is out there. So some of the stuff isn't like shockingly new. It's just this, right. They're reporting what others have reported, but the exploration of identity is natural, normal, common in young children. Many people go through an exploration of things like this, but rarely does it ever require clinical treatment. However, what they found in the past 5 to 10 years, there has been of an epidemic proportion of young children coming forward saying that they're having gender identity issues, as particularly amongst young women, which is what Abigail Schreier pointed out years ago. And an overview of their key findings here is that they say there's no simple explanation for the increase of numbers of predominantly young people and young adults, but there is a broad agreement that it is the result of a complex interplay between biological, physiological, and sociological factors. This balance of factors will be different in each individual. So they're stating right out of the gate, it's very complex.
Yes. And
must there be treated with proper, because of that. And it's not a simple treatment plan for any given patient, that it's very, very complex. They go on to say there are conflicting views about the clinical approach. So there's not any agreement about the best way to do this. They found that there is no single guideline that could be applied in its entirety to the NHS in England. So they still lack any kind of guiding principle, guidelines, ethics. There's nothing to guide them on this.
Yep.
They pointed out that while a considerable amount of research has been published in this field, systematic evidence reviews demonstrated the poor quality of the published studies, meaning there is not a reliable evidence base upon which to make clinical decisions or for children and their families to make informed choices. So they found, like what we've been saying, what other people have found, there's no good evidence to guide clinical decisions or for parents and children to make their choices. It's hope, it's faith, and it's hope and faith in an ideology. It goes on. There's a couple more things here. It says the rationale for early puberty suppression remains unclear with weak evidence. The use of masculinizing and feminizing hormones in those under the age of 18 also presents many unknowns. Despite their long-standing use in the adult transgender population, the lack of long-term follow-up data on those commencing treatments at an earlier age means we have inadequate information about the range of outcomes for this group. So again, we have no idea what this will do to them. They go on to say clinicians are unable to determine with any certainty which children and young people will go on to have an enduring trans identity. I mean, this is where this just gets insane, right? They're pointing out that exploration of sexuality and gender is a normal experience for many young men and women.
Right.
Mm-hmm. Most of them will not require any kind of clinical treatment. Those that do, clinicians have no ability to know if this will be an enduring struggle of theirs or how long it will persist. They don't know the positive outcome of radical treatments. And you take all this together, why is anybody letting them go forward with radical procedures, puberty blockers, hormone therapy, surgeries, when everybody knows? We don't know if this is going to work. We don't know if their gender dysphoria will persist. We know a number of them almost grow out of this in the sense, hell, let's just see what happens.
Right.
It's absolutely ridiculous. It's the experimentation on our children for the sake of an ideology. We have to reshape the world in our image, and damn it, if we have to sacrifice some kids along the way, who the hell cares? That's what's happening right now. And people are starting to see this and becoming angry about it. And anger by itself does no good. Anger needs to motivate us to action. And that's what's happening. So going back to the WPATH files, is it Schellenberger?
Yeah,
Michael Schellenberger. I can never get that last name right. He's one of the main guys behind the publishing of those leaked documents. And he said for years he was in the camp of, it really can't be that bad.
Right.
Like he said that. As you're starting to hear some of these stories, like the Chloe Cole story and the horror of it, he's like, surely it can't be that bad. And he said, because if it was really that bad, he believed somebody would be doing something about it. Like this can't be happening in the medical community because somebody would stop it. And so he kind of lived in this cognitive dissonance for years until he saw what was happening for himself. And then he was like, yeah, nobody's doing it. It's worse than what I thought. Nobody's doing anything about it. And that's why he's decided to speak up and act, and more people are doing it. And it's why, we've been talking about it for years, but that's also why we're doing this again right now. This practice has to end, regardless of what you even think about transgenderism, which we'll get into how you look at that biblically. Regardless of your view on that, I think it's clear to any sane person that this medical practice has to end. It is barbaric on a level we've not seen in the United States in quite some time.
So I think this is why I think it's what happens, and the way people usually, I think the methodology of fighting and getting and winning an argument in our culture today is to do it ideologically versus off of facts or reason or science or anything like that. And so as a result, what often happens is this topic is phrased as it's the people who are religious, or it's the conservatives, or it's the right, or it's Republicans versus it who hate the trans people. They hate they hate, they want them to, to not have equality. They want them to live miserably, right? And what I think these WPATH files and the Cass review are demonstrating is actually that's not at all what's happening. And I think what people need to stop doing is trying to amplify their argument. They're not going to stop, but amplify their argument by just saying it's these evil people who are the ones who are pushing back. Because when you read the Cass report and you listen to what Hillary Cass, when you listen to her interview, stuff like that, she is actually, she's a former pediatrician or pediatrician training. And I don't know if she still practices or not, but pediatrician, but she's actually not against transitioning for minors. This is not a woman who says that minors should never be transitioned. She just says that she would bet that it's a very small number that would benefit from transition. And those that do decide to transition in this small number need to do it under a controlled study where they can be closely monitored and get the appropriate services that they need. She also says that she doesn't even think therapy should try and change somebody from feeling like they're trans or experiencing gender dysphoria. So the reason why I say this, and I want people to understand that this is not a biased review. The Cass report is not a biased review. The WPATH, obviously, it's a file dump of emails and things like that and videos and that kind of stuff. But these are not people who are trying to quiet the trans community, who don't support young children and the things that they're going through. These are people that are actually just saying, look, our approach doesn't seem to be working. It was never based on evidence. We need to pull back. We need to reevaluate how we do this. And that way we can put a proper approach going forward. And this is why the NHS has shut down Tavistock in terms of being, which was their big gender clinic. That was the gender clinic in England. They shut it down in terms of it being functioning at the same level that it was, basically, where kids could come and get all this gender affirming care and puberty blockers, that kind of thing. What they're now moving to is a more regional method, smaller method type offices that are centrally, that there will be communication between them all. They're not independent, but there is some sort of governance over them all and collaboration between them. And they're going to focus much more on mental health. They're going to focus much more on mental health than doing puberty blockers and all of this.
Yeah, well, and that's where this seems like this is a massive undertaking. If you were to step back, how long this would take is something. But going back to one of these earlier points, how complicated this is, because you have the medical community trying to address a psychological issue. That right there is pretty novel almost in itself, where you're trying to take a psychological issue and correct it, improve it, relieve some of the stress in someone's life, lead to flourishing happiness through a physical route of, physical surgeries, medication and whatnot. That's just really challenging, especially with so many of these, like the detransitioners coming out, or not even the detransitioners, what the study is showing, that these patients have a number of other psychological issues that they're dealing with. It's a very, very messy and complex situation. And the amount of time, who knows, but the amount of time it would take to bring this in line, even if someone like Cass, who's like, yeah, small percentage, this is fine. The amount of time it's going to take to bring this into a proper clinical setting, I don't even want to guess how many years that would be, but I can't imagine it's going to be anytime soon.
So it's interesting. So Dr. David Bell, who was a psychiatrist at Tavistock for 30 years, he actually became a whistleblower for Tavistock. And he is just in agreement with what you're saying. He says that it's actually inappropriate to engage medically with kids with gender dysphoria. And the reason is because he's recognizing that it has to do with psychology, and it has to do with their mental health and these kind of things. And so he became one of the whistleblowers as a psychiatrist that was at Tavistock for all these years. And I think this is what not just the UK, but Finland and Sweden and Denmark, and I think I've heard Germany and France as well. Like Europe is beginning to actually say, we are going to take a step back and follow the evidence and realize that medically we are not helping them. And when I speak on transgenderism, there's a particular study that I show that came out from the American Urological Association. And they look at, this was just earlier this year, I believe in 24. But they look at people's suicide attempts after surgery and before surgery. And they found that with men, so male to female, that they were suicidal before surgery, actually were more likely to be suicidal after surgery is what they found. So what we're seeing now is that the data is showing that the medical way to deal with gender dysphoria is no longer the way we should be going. And it is not doing what we think it is.
And the societal doesn't accept it piece is like society just doesn't accept them. That's why the suicide rate is so high. That argument is beginning to fall on deaf ears because one, society is very accepting, right, generally speaking, but moreover, we're hearing the story after story of those that go through these radical surgeries talking about they themselves do not like how they look.
Right.
Not that society is rejecting them, that they aren't happy with the way that they now look, and not even just considering how bad the surgeries are, but they themselves are saying, I'm still not happy or satisfied with the way I look and the way that I feel, not because people are rejecting me and aren't affirming me.
Exactly. And so think back to the story that I said in the beginning about Griffin. Even after double mastectomy, still did not like how she looked and would not go around shirtless, even as she was a boy, would not go around shirtless, was struggling with acne, was struggling with stretch marks, was struggling with all of these things, was still not happy post-surgery. Same thing you hear with Kiara Bell, who's, if you ever watch any of her videos, will break your heart. She's, I think, in her probably mid 20s or so, detransitioned out of the UK. She's one of the big ones that was raising a lot of stink about her experience under NHS and how did people let this happen. And she just talks about how like she can't believe her body, like she's got this deep male voice now, and just these changes in what she's done is just beyond what it's just breaking her to tears. And you watch these videos and you're like, oh my goodness, like you see all of that happening. So yeah, they're not happy. It's not because of culture. Culture is very supporting. It's because we actually cannot make girls be boys, and we actually cannot make boys be girls. And the reason is because it isn't just even about genitalia. Number one, we don't know how to do the surgeries. Okay. We do not know how to do the genitalia surgeries, and it just can't be done unless they're trying implants now, and they're trying all kind of things to try and give uteruses to guys so they can carry babies, all these things, right? Keep in mind, men's hips and women's hips are different, right? Testosterone and estrogen will not affect the shape of your hips. It's why men can run faster, because they have a different pelvis structure than a woman does. A woman's pelvis is shaped for running. Shaped for birth, for childbirth. And so men are better able to run because of the shape of their pelvis. And so when you give somebody estrogen or testosterone, it does not shift their bone structure. So you can try and implant a uterus in a guy whose pelvis is not shaped for childbirth, and that guy still would not, even if the baby can somehow grow, still would not be able to have natural birth, because the pelvis doesn't allow for that. The opening isn't big enough in the pelvis. So you'd have to do a cesarean. So you can't even, we're living in a delusional world here that we think that this can actually be, that we can change facial hair and body hair and voice and genitalia, and that somehow makes you the opposite sex. sex. Wrong. It doesn't, because your skeletal structure is still male or female, and your brain function is still male or female. Because if you're born a boy, 7-8 weeks in utero, testosterone at 7-8 weeks in utero begins to masculinize your brain. The way the neurons process is differently. The size of a men's brain and a woman's brain is differently. Like all of these things, there's more to your body than just your genitalia that makes you male or female. And so let alone the gametes and all of that kind of stuff. The point is, it's not possible. It's just not possible. And that's why when people are on these transitions, not only are they unhappy with how they look now, but it turns out the gender dysphoria was not the source of their pain at all. And that's why when you do all these attempts to fix their bodies, they're still not happy. They still don't like it, even though they're girls looking more masculine. She's still not happy because there was underlying conditions that were there before the gender dysphoria ever came into be. And so we're taking these young people on a journey that they'll never reach. Chloe Cole could never be a boy. I could never be a man. That's just the truth. And we don't want to tell people the truth because we don't want to hurt their feelings. But look what we're doing. We're destroying their bodies, and they're hurt on the back end.
And to quote Chloe, she said, "I didn't need to be lied to.
There you go.
I needed compassion."
Yeah.
Which is very sad when you hear her tell it, but it's also quite profound, right? Where she recognizes truth-telling and compassion go together. Mm-hmm. And we live in a world that wants to say they're fundamentally opposed. That, well, I want to move into what can we do instead of just be angry by this. Because I'm a guy. That's what guys do, right? We want to solve a problem. It's amazing. I waited 40 minutes to get into how do we fix this, right? It's kind of like what guys just charge ahead into. But I do think one thing we can do is just to know the facts. And this is just a true principle in life. You always have to ask ourselves, have our beliefs met the facts? Have our opinions met the facts? When it comes to something like this that we all have strong beliefs on, have those beliefs met the facts? It's important. So read the WPATH files. We'll put links in the descriptions here for the WPATH files. I know what you're getting into, though, too. Those WPATH files, they got some images that you can't unsee once you see it. Read the cast report. Become knowledgeable. Share the basic facts with other people too. Can be very helpful. But maybe transitioning into what to do and how to think. I do want to talk about how do we think about this from a biblical worldview. How do we think of transgenderism? How do we think of male and female? How do you, to what extent do you address this biblical worldview component in the talks you give on transgenderism? And how do you go about it?
Yeah. Well, I think probably the key thing is, I think whenever like just like you said about Chloe, right? I didn't need to be lied to. I need to know the truth. Like I wanted the truth. That's what I needed. I needed the truth. And I think what I try and do is I say, look, whenever I speak to my audiences, I tell them, look, when I watch the Chloe Cole video and she says things like, I didn't know. And you watch other detransitioners, they say they didn't know. I tell my audiences, I want to make sure that you walk away from here and you can never say you didn't know. And so after talking to them about all of the different effects that puberty blockers and testosterone and estrogen will have on them, I want them to know the truth. And I find what's so helpful in the infinite wisdom of God is he knew in 2024, in 2023, in 2022, and years prior, that we would struggle with knowing something which may have seemed basic or clear to other people, but we would struggle to know whether or not we were male or female. And so I find it extremely helpful that in the very, very first chapter of the very first book, Genesis, that we are told that we are created male or female. And that created is referring to the idea of shaping or forming. In other words, you were shaped male or you were formed female. In other words, this is a very physical description. There's a physicality to your male or femaleness. In other words, you weren't feeling into being a male or you weren't emotioned into being a female. You were physically shaped or formed into being one or the other. And so when you have confusion about who you are, the best thing to do is to ask the being that created you, what is it that you intended for me? What do you intend for me? Who am I? How do I know who I am? It's so confusing and it's so difficult. How do I know? Bring me clarity and tell me. And I just see a mercy, I feel like, in that God did make it clear. You know, you and I can go on about this and we get riled up about this because we're frustrated. We're frustrated as to what is being done to innocent children. And that compassion is what fuels us. And I also think it's compassion that puts something so powerful in the beginning of Genesis to let us know your male and female is not about your feelings, your emotions, or your thoughts, or what clothes you wear, your length of your hair, or your nails, or high heels, whatever it might be, makeup. Your male or female is in your physicalness. So whether or not you like cars if you're a boy, and whether or not you like Barbie dolls if you're a girl, is irrelevant. It doesn't change whether or not you're male or female.
The Bible, there's a lot of misunderstanding about it, of course, but it's so important. And for those that are trying to think about this issue from a biblical worldview, and there are a number of people that are Christians that don't know what to think on this. They struggle with it. They know someone who's transgender and they want to love, they want to affirm, they don't want to fight with them, and they have a hard time thinking about this biblically. I think Genesis is really important because it raises some important questions for us. Why did God design it that way? And is God's design arbitrary and whimsical or something else? Is there something really sacred and special in our maleness and our femaleness? Or is it just random and whatever? It's like, you want to go as far as saying God was not needed to make us as sexed beings? Was it superfluous? Or is there something special in this? And I think there is something special in it, and that's really getting washed away in our society where we're trying to make men and women there's nothing different about us. And you're right, there's a lot of the cultural expressions of being a man or a woman that some of those can come and go. Some of them may not be so arbitrary because I think there are certain cultural practices and expectations that do allow a man and a young boy to work out what does it mean to be a man amongst other people. So there can be certain cultural practices that are good or bad, I guess is what I want to say, but they're not immutable. Like you can't ever change them or question them. They are fallible. But gendered roles or cultural expressions of maleness and femaleness to varying degrees, I think can be helpful if they are helping you learn how to live out what does it mean to be a man or be a woman. But those can be changed. But again, going back to Genesis, one of the things that's very clear from the biblical standpoint is that men and women are both created in the image of God, which means that men and women have equal dignity and value, and it is intrinsic to us.
Yes.
That our value, though we'll get to being male or woman, is important, it is not value determining.
Right.
Our value is prior to that. It's what we are, being made in the image of God. Men and women share that equally. Men and women share equal value and dignity. When it goes on in Genesis 2 to talk about the creation of Eve, the Hebrew words that are used here, eitzar and kenegdo. Mm-hmm. And like, if you read the NIV, it's translated as like suitable helper, which is somewhat unfortunate for us today because the word help, there's a lot of cultural baggage from slavery and racism, and segregation and the help. There's even a movie made on that. So help suitable helper kind of conveys that women from a biblical standpoint are just there to kind of pick up the bags for men.
Right.
They're just a suitable helper, but that's a translation challenge, not a biblical challenge. I mean, not the point. What am I trying to say? The message that's being communicated in the original language is pretty clear, and that it's women are like a worthy counterpart to men. Men and women given the task to have dominion over the entire earth. They're to do this in cooperation with one another. One of the fundamental ways you do it is through the family. And God saw that man could not do this alone. He needed a worthy counterpart, someone equal to him in dignity and value and meaningfully different. That's what those two words convey. And so the biblical take is that men and women, again, equal in dignity and value, also equal in the calling that they've been given to have dominion over the earth. Yet there is something meaningfully different about men and women, that when men and women work together in love and with an aim to honor and glorify God, it's something beautiful, and it is something needed to honor God well and to have dominion over this earth. Why do you think that biblical message, the full dignity of men and women and their the meaningful differences, why is this now cast in a negative light, or why isn't this seen well? Why isn't this seen as gift? Why is this seen as something oppressive, maybe?
Well, I think it's, and you kind of alluded to it a bit in the sense of when you talked about how help is looked at as lower because of some of the slavery and the racism and things like that, right? In other words, when situations are abused, then it takes a lot of work to recover something that is actually good and beautiful, which is the differences between men and women. So, when women have been mistreated, or women is kind of like, well, they're not smart enough to do this, or they're not strong enough to do that. I mean, I'm sitting here wearing one of my hockey shirts, the girl hockey player with a ponytail. You go back, I don't know, probably 50 years or so in history, you're not going to see ponytails out on the ice like that unless you're just playing backyard hockey with your brothers growing up in Canada or Russia or Europe, Eastern Europe or somewhere like that. But so this idea that women couldn't do, and then you hear the word help, and then you think of all the connotations come with that. That seems like there's like this belowing thing. It's like she's somehow below. And I think this is why there's so many misunderstandings and things out there that are said about the Bible. But God is such an equalizer when it comes to, the idea is he actually needs help. Like the man actually, it wasn't like, hey, you know what? Let me just give him somebody to make jokes to and laugh at his jokes. He was like, actually, he is in need of somebody to do this with him. There is this idea that she is more than just a sidekick. And so I think we just have to reclaim these things that I think the cultural stereotypes and the negative aspects of culture have just taken away from something like this. And so I think that's why people struggle with any of these understandings of what the Bible says about women. It's why Jesus was so radical, because you saw it even by the time that Jesus was walking and on earth, and the Pharisees and the attitude towards women. And then Jesus would, allow a woman to let her hair down in front of him, which was crazy that a woman never did that in front of a man. And people talked about, look at this guy, he's blah, 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 or having sympathy on the woman caught in act of adultery, or talking to the woman at the well. He did all these things to kind of say the God of the universe sees you, and the God of the universe is sticking up for you. And he's valuing you, as all the other people around want to point fingers at you. And point fingers at me. The God of the universe is making sure that people see how much I respect and value you and love you. And I think that those are important things that we forget because we let the culture translate the Bible for us.
So I think it's beyond the scope of this conversation to get into what then are these meaningful differences between men and women. It's, one thing to hear you and I say, created equal in dignity, share the same calling to have dominion, yet there are meaningful differences. Okay, well, what are those differences? That's probably too much to get into at this point, because you can talk about, there's just too much to get into.
So many, yeah.
I think the point I want to make, though, is that this kind of conversation should be had in local settings without the fear of being called judgmental, oppressive patriarchy, patriarchal and outdated. That to talk about meaningful differences isn't oppressive. Rather, it's an inquiry into God's design. And as we apprehend and understand God's design and live it out well, I think the hope that we have is that it will lead to flourishing. Because unless we think God's design is bad and he did not know what he was doing, I think it's right for us to have an expectation of in understanding his design and living accordingly, it goes well for us. And we find joy and we find flourishing. So I think this conversation just needs to be had, despite its baggage, despite the fear that people have. And we need to be open about having these conversations and inquire, what are these differences? What does it mean to live as a man? It's crazy, right? We're like the first people in the history of the world that don't really have any sense of what does it mean to live as a man. And then for me to like feel like I'm doing something immoral if I try to answer that question to my son, Conrad.
Yeah.
Isn't it good though that we can have clear answers to what does it mean to live as a man and pass these things on so that we can use our distinctiveness and our gifts to love other people well and to love women well? So we just have to I don't know. The point I think I want to make, instead of getting into a list of these things, is just to make the point that we have to be talking about this in our churches, in our homes, and from a societal standpoint, we have to be able to engage in this kind of conversation without the fear of being shut down as being a misogynist or whatever.
Yeah. And I find that when I speak on this topic, and I actually do go through some physical differences between men and women, most times actually the audience finds it humorous because they're like, oh, we totally see this.
They get
so
it,
even
right.
something silly like, that men have a better tolerance of cold than women do. And all the women are like, yep, that's so true because I'm always cold and he's always hot. Like they just find, like, as we begin to list these things, like women can thrive better, sleep deprived than men can. There's another example, and people are like, oh, wow, this is so funny. This makes sense.
That's cool.
It's all of these things that when we actually start listing out some of the biological differences, how women have a better taste of a better sense of smell, but men have more taste buds and these kind of things. Like people actually find them funny and they're like, this is cool. Like we're different. Like this is really neat. Like they actually embrace the differences and we can get ourselves past, like if there's no difference between a man and a woman, that then we can't, the only way to have people equal is if we are exactly the same, as if differences can't still be equal. And until we can get past that. Isn't that indicative
of an immature person? That it has to be same for it to be equal in like dignity and worth. I think that's like an immature. A grown up can understand differences don't lead to inequality.
Right. Exactly. So, and that's the key thing.
Yeah, so I'm encouraged to see some breakthroughs in what I'm talking about here. For years, the neurological community, scientific community, researchers, they were shut down for fear of, if they were to find any difference in a male and female brain, that it would just further an inequality kind of outlook on men and women. There's a lot of political pressure for neurologists to not research like sexual dimorphism in the human brain. Well, finally, enough neurologists said, to hell with that. This is bad for women, because if we continue to do research and develop treatment plans, both medically and psychologically, on the assumption that there is no difference in male and female brains, who's harmed is women. Because most of the experimentation pertaining from lab rats to whatever, it's always done on the male brain. So they broke free of that and began to find in the last 20 years some really interesting differences, things in the way that men and women process memory, the way the difference that men and women process stress, and just a number of meaningful differences in the male and the female brain. And in understanding this, we can cherish the differences, thrive in these differences, have compassion for the struggles that come with the differences for one another. And we just need to start living in this space with the freedom to explore God's design here. And so that it may go well for us.
Yeah. So I don't have it in front of me, but I know that there was, and if any doctors are listening will know this for sure, but there is a difference biologically. When you're talking about the medical, that they have to be honest with it. There's a difference between men and women, because even the way women respond to aspirin is different than the way men respond to aspirin. So even something like that is fundamental, even when it comes to medical here. So we don't want to shy away from these things in lieu of, trying to be politically correct or trying not to be offensive. It's okay. I can look at my neighbor and say, yeah, they're different than me in 45 different ways, but they're definitely no less valuable than me. Why would we say that about the men and women relationship then? that differences somehow mean our description of value. That doesn't make any sense. So I wouldn't say that about another human being. And we shouldn't do that from the male and female thing. And I think, and that's one of the reasons I think that has led to some of the transitioning as well, especially among young girls, is they're scared. It's not so much that they want to be boys, it's that they just don't want to be girls. They're scared to be girls or scared to be women because they're told women go through childbirth and it's horrible. And they're told women get paid less than men when they get a job. And so they're scared. It doesn't seem like it's going to be good and they're more likely to be abused or to be like, they're just like, okay, well, let's be a boy. It's safer. And so I think sometimes we don't really think of the long-term implications of what we're saying here when we say some of these things. I've been a woman for a long time. I like being a woman. I think it's pretty cool. We used to make such jokes when the book like Men Are From Mars and Women Are From Venus came out, and we'd be like, oh yeah. Like we used to think that stuff was great because we appreciated the differences between men and women. And we thought it was funny, and we thought it was like, it made sense. So I just hope we can get back to that kind of position at some point.
All right. Bit of a change here. How do we care for somebody that's going through gender dysphoria, thinking about transitioning? And, for those that are in the church, almost everybody knows somebody like this now in that category. This is not a fringe issue. It's very common. I know you get asked that question when you speak on this topic. How do you answer it when a young kid asks you, hey, I know so-and-so is going through this. They think they're transgender. How do I love them? How do I help them? Right? Because they're told love means affirm only. They don't have a conception of love that is beyond affirmation because of the society that we live in. Christian view of love, right, is seeking the good of another, even if it comes at great cost to oneself. So how do you answer that question for young adults in particular, how they can help a friend who's going through something like this?
Well, it's interesting because I think my answer's slightly changing in the sense of more and more stuff's coming out. There was recently a Doctors Protecting Children declaration, which came out in America, which is a big deal because everything that like WPATH is a global organization, Cash Reviews in the UK, but to have the American Medical Association's sorry, let me not say that because it's not the actual association. To have American doctors be willing to come forward and say that there are issues with gender care, I think should be is important for people to realize whenever you're dealing with somebody who says that they are struggling with gender dysphoria, it's going to be helpful for you to know that now it seems like the American medical community is slowly going to be more supportive to helping your friend or your child in a better way than they had before. Now, it may not be something, it's not going to happen overnight because it's going to take some time for things to kick off here. But so I would say, whenever you meet someone who is struggling with this, I always encourage people to do several things. Pay attention to their social media usage. Pay attention to any mental health conditions that they have going on. They're most likely depressed, anxious, autistic, or have ADHD. So pay attention to those pre-existing conditions. Pay attention to who is influencing them. Who are their influencers? And that is really important as well, because we are heavily, it's what social media is. It's an influencing platform. So we are heavily influenced by those around us. So who are the friends and how are they impacting? And so I've even heard stories of parents who have children struggling with gender dysphoria and they pull their child out of school and homeschool them. Now the child doesn't have gender dysphoria anymore, separated from the friends, from that environment. So I would really encourage anybody to not do any kind of treatments and anything like that, but to first just pay attention to what is actually going on in their lives, social media, friends, mental health conditions, etc. And after that clump, I would strongly encourage people to not take any sort of medication, not puberty blockers, not testosterone, not estrogen, to give yourself time. And so the Doctors Protecting Children Declaration, which is a combination of American doctors from various fields, says this. They say that most children and adolescents whose thoughts and feelings do not align with their biological sex will resolve those mental incongruencies after experiencing the normal developmental process of puberty. They go on to say that in the largest sample to date of boys clinic referred for gender dysphoria, so they're boys to girls, boys that are clinic referred for gender dysphoria, there was a desistance. So basically they moved away from being transgender. Desistance rate of 87.8%. That is high. So the idea is if you can leave somebody alone, and this agrees with the CAS review, this agrees with even WPATH and things that we're saying. If you leave people alone, let them experience, go through the challenges of puberty or go through the challenges of whatever they're doing in their life, help them process through those challenges. And because ultimately, I think what so much of this is we are trying to find a way to escape from the pain of life. So life hurts and we are trying to find a way to escape from it. So if we can deal with the things that hurt in life, we may not feel the need to escape. And if we can kind of focus in on those things, I think that'd be helpful.
So leave them alone. I get what you're saying in the medical sense. When a young person would ask me, for example, what do I do with this person? It's obviously not leave them alone in a relational sense.
No, right.
And if it is true, what studies have shown that gender dysphoria does not persist in a number of them, and it goes away over time. They need someone to love them through that. In a gospel kind of love. This is what, going back to Chloe Cole, the story she found that online community, and their love was affirmation oriented. And in fact, she found that when she detransitioned, that love went away. So it was incredibly conditional.
Yes, it was.
A conditional acceptance that she found. So for a young man or woman who's a follower of Jesus, who knows someone in their class that's going through this, you don't have to treat them like a leopard. Someone has leprosy, not a leopard, like they have leprosy. You can even befriend them.
Yes.
Ask them their story.
Yes.
Ask them, what kind of help are you get? Who's helping you with this? Ask them what kind of, do they feel like they're getting good information? Are they getting the facts? Are they getting help? And if someone has that kind of support, which is the support Chloe was desperate for, not the affirm, go this way, affirm, go this way, 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 but somebody that says, well, hey, tell me what's going on. Do you have the information? Are you getting help? Have you considered the consequences? Are people telling you these things? That's the kind of friend many of them need, especially if it's true that this does not persist. So it's a good opportunity for Christians to love in the true, in that sense of the word love, not just show affection, but to seek someone's good. This is an opportunity for the light of the gospel to shine really brightly. And I know you came across a quote here recently, didn't you? Where someone says, you can't bleep it out, right? Do you remember that quote you were sharing with me?
Oh. So this was a quote from a female to male detransitioner. And I don't remember exactly, but here's the paraphrase. She basically said, it was on Twitter, that she really wants to hate Christians. And then she put, Christians, send me messages, always praying for you, always caring about, love you. And then she's basically like, I just can't hate them. Like, she wants to hate them. She wants to be mad, but she can't be mad at them because all they do is shower her in love and prayers. And man, I just wish I could, if it didn't have expletives in it, I would post it everywhere. Because I think it's so powerful. I think I think this is what people need to understand, that, what helps people to actually find this whole Christian message beautiful is their interactions with how they watch us, how they engage with us, how we love them in spite of their mess. And here is the thing that Christians need to understand. They're loving you as your friend in spite of whatever you're going through. Gender dysphoria may be their thing, but you're probably going through your own stuff and they're loving you through it too. This is what we do as friends.
And so it's a cheap love that only affirms. And there will come a day when someone looks back at you and says, no, I needed you to love me a different way. And that's what Chloe's saying. And this is an opportunity for the true love of Jesus Christ to be known in this world. And so we've got to be willing to speak on this, not just through Twitter and sound bites, but in our relationships. And this is one of the ways I think that we can do that. And great opportunity for the church here, and we don't need to squander it. Hey, one last question for you. I know this is your favorite arena. So I think there's a relational pathway for all of us, which involves growing in knowledge ourselves. If we know someone that's suffering from this, that kind of our posture towards them needs to be just wait. Do you understand? Are you getting help? Do you have all the facts? Are you aware of? So there's a relational pathway that isn't easy, but seems rather straightforward to me for how Christians are to respond to this. What do we do politically, though? What do we do civically? I mean, if part of this problem is these practices in the medical community and psychological community, well, it's not really a relational pathway there. It's a political one. Are Christians to touch this topic? Or are we to stay out of it? How, if we're to engage it politically, what are some ground rules maybe in your mind on how to do that?
Oh, yeah.
You were hoping we were running out of time, weren't you?
Like Christians engaging in politics. Oh, this always goes well. Yeah. So, if you're going to engage it politically, I think you would need to do it very carefully. I would probably say there's probably a small number of people who should be public about it from the Christian perspective, just because it will only feed the stereotype that it's about Christianity versus the trans community. And that won't help with progress. That will just make people say, oh, I hate Christians. So therefore because all we do is ideologize. We just pick a side and I hate that side. So I'm just going to join with this group. And so it's like, oh, we hate the Christians. So whatever they say, I'm going to be against. So I think there's only a very small number of people that if you know it and you've studied the material and you can do it in a way that is loving and kind, because remember, these are people's bodies that are being destroyed. I recognize the frustration and anger with that topic and what doctors are doing. Absolutely. And therapists are doing. Absolutely. But at the end of the day, these are people whose bodies are being destroyed, and it should break your heart. And so anything you do is going to have to be done through that posture. But I think we need to, as people, just not get caught up in, not allowing like an ideology to, I don't know, to make us pick a side, or to, maybe that's not really the right approach. I guess I just think that this is an issue that we have truth to. So look around and like we just talked about this last topic, you've got people in your circles that may very well be struggling with it. What can you do in your immediate circles? What can you do with the people that are around you? What can you do with your neighbor? I have a friend who's a teacher what about her students if they come out as struggling with gender dysphoria, right? So you have all of these circles that you have around you that are separate from the larger scale political realm. But don't blind yourself to the impact of the political realm too, because you have to understand that politicians do have power. And they can enable parents to not know. Look what's happening in California, where Newsom basically is taking away parents' rights to even really, I think to know what's going on at school. Schools can transition kids without even parents knowing. So these politicians do have power, and you need to keep that in mind as well. Like, don't get sucked up in saying, well, I hate this person, so I'm just going to vote for this person, because look at what they hold in. Look at what the implications of voting for this person. And likewise, both ways, like we have to recognize that politicians have a bunch of different issues that we like and don't like, but they have power. And how are you going to land on that? So I think it's a difficult place.
It's difficult. And if I'm hearing you and tracking with you, it's something that must be approached with caution and wisdom, but it must be dealt with. Christians cannot stay out of the political arena. We're going to talk more about this on another Ask the Apologist, another thing we do with our cohorts here. But God does hold sovereigns responsible in Scripture. And the question is, what does that mean for countries that are built on democracy? We're not a true democracy. We don't vote on everything. Right. We're a representative democracy. So what does that mean for us? It's a good question. We'll need to dive into that more at another time. But I think it means at least we bear some responsibility that God will hold us accountable for. Moreover, we can view politics as a means of loving our neighbor, and ensuring that there is good law and good legislation that leads to human flourishing. And it's silly to reduce this as forcing your religion on people. We're not forcing you to become a Baptist or believe in Calvinism versus something else, or infant baptism, or how often to take the Lord's Supper and stuff like, we're talking about basic human flourishing. It's silly when there's legislation relating to murder. People aren't looking at Christians saying, hey, who are you to force your religion? The Bible says do not murder. Don't force that's just a childish way to look at this. There are good laws and there are bad laws. Good laws lead to human flourishing with a conception of human flourishing that matches reality. So at that, Christians, we turn the government over to atheists or something, or pagans? That's just a silly. Christians, we ought to be involved in politics, which means we need to think rightly about politics, which means to some degree, churches need to teach their people how to think about politics, which of course isn't the same thing as saying, vote this way, vote that way, vote for this person, vote for that person. How do we even begin to think about politics? Unless we think that the Christian worldview just ends at the Capitol steps, which I think is a pretty dumb idea, and it's a pretty bad biblical. I don't know where you're getting that out of the Bible. The Christian worldview covers everything. And so we need to be aware of things like you talked about. Again, we focus so much on national, but what about local? What's going on in our own home turf? There's a lot of amendments right now on another topic, like surrounding abortion. Mm-hmm. People need to know about these amendments. There's one in Florida right now that our ministry is helping to just educate people on what is the pro-life position and what does this amendment deal with. And the Amendment 4 being proposed in Florida, among other things, rips parental consent right out of this. So if it passes, that would mean minors can get abortions without their parents even knowing it. That right there is a bad law, regardless of what you think about abortion. That right there is a terrible law that will be written into the state constitution if people don't go vote no on this in the Florida or in the November election down there in Florida. It's crazy. So anyways, Christians, being politically minded isn't the same thing as worshiping Trump or something like that. Being politically minded means we want to love our neighbor by seeking their well-being, ensuring that there are good laws and good lawmakers in place. And so growing in knowledge is important, and it doesn't need to be something that Christians don't touch.
I think that's really good. And I think we remember that politicians ultimately want to get elected. They don't always care about truth. So you know the truth, and that should matter to you. And when you hear them say certain things that you know aren't true, then that should let you know if that's what they're willing to say to your face, lie to your face about certain things. So what are they doing behind your back that you don't know? So I think we need to remember that. I think the big thing that's being advocated for by Michael Schellenberger, who released WPATH files, by the Cass Report, by Doctors Protecting Children, by all of these groups, is ultimately, let's follow the evidence and the science. Let's think about this reasonably and rationally and not as an ideology. And I think our politicians follow ideologies oftentimes, not all of them, of course, but just keep that in mind. Are they someone who's looking at reason and facts? Or is it somebody that is just wants to get elected, and so they want to make as many people like them as possible? So that's,
grow
I
in knowledge
important.
Yourself. We'll put the documents that you in the description that you can become more educated on. Equip yourself, equip your neighbors, pester your politicians, write them letters. This should direct how you vote. It absolutely should. So be careful about what candidate you are endorsing and where do they stand on an issue like this. This matters, and that growing knowledge on these issues so you can be so you can love your neighbor well. Also, if you're interested, by the way, about what we mentioned there, this Florida initiative that Apologetics Inc., the ministry that we work for, is a part of, you can check it out at apologetics.org/pro-life. And if you want to get involved, you'll see how to there on that page. I think that's it. That's all I know, Alycia. You got any other brilliant things to say before we get out? Or maybe we should just get out before we get in trouble.
Yeah. Because we end on politics. That's great. That'll get us, that'll do us well.
Yeah. Well, hey, thanks for your time. And
thank you.
Well, I'll see you soon.